big question on Jing TV is how soon after surgery can you treat people, right? So that kind of comes up quite a lot in class.
Yeah, absolutely.
So what do you have to say about that?
What I have to say about that? Well, as always, you want to treat the client, not the idea, if you like.
Yeah.
So it's not just one question. When should I treat client after surgery? So it depends on the surgery, depends on the makeup of the client. I mean, pretty much we would feel confident in treating a client immediately, I would say, after surgery, and certainly have done. So there's lots of things that you can do, even if you're going to not directly work on the site of surgery itself.
Absolutely. So the things that you want to look at is the surgical site, right?
Yeah.
Are you going to treat it on the surgical site? Okay, the questions there, you need to look at it. Is it still healing? Is it red?
Yeah.
Is it hot? Is there any way that the surgical incisions have not started to sort of be able to come together?
Yeah.
And any kind of work that you would do would be really direct on that would cause damage. And I feel like I'm always really interested when massage therapists ask these questions, because I think these massage therapists...
It's common sense, a lot of it.
But I think that's the thing, is like massage therapists kind of are one of the kindest people in the world, who have the most amazing sensitivity of touch. And so if we can say anything back, it's always like, well, just trust your sensitivity of touch.
And I do always think common sense, although my mother accused me of having very little of this. It's always good to employ it in massage situations. So obviously if somebody's got a very hot, raised, red, suppurating kind of wound, you're not going to go into there and do loads of cross-fibre friction. Or, that wouldn't make sense. But you might be able to just, and do some very light work, even just above the area of the body. Sometimes more energy work, or very light, just resting.
Even that.
Or even just like very lightly resting on the body.
Yeah.
So, or you could work other areas, relaxation. We know that people after surgery, there's a lot of emotional stuff going on as well. It's very traumatic to have that work in the body.
And we know that treating scars quickly can make a difference, not only to the appearance of the scars, it's also the functionality of the area.
So scars is very interesting, actually, because there are some schools that still teach that scars shouldn't be massaged for up to 2 years, which is crazy. Because even medical guidelines suggest that scars should be self-massaged as soon as possible to improve the appearance.
And there's more and more happening after surgery, where people are being taught how to treat their own scars. And effectively what people are getting taught is myofascial release, like J-stroking around the scars, or skin crawling. And I'm doing that because I can remember a client who'd had a tracheotomy, and that kind of work here was really easy for them to access, which was basically locking and kind of moving around the area.
So scar work is really important to prevent long-term problems.
So I think generally the outline, 6 weeks to 21 days around working directly on a scar site. I think after surgery, how quickly can you treat with somebody? Absolutely the next day in a way that you think is reasonable. So that might be working distance from the area, dealing with all the other things, recognizing that the surgery involves a whole bunch of other things, like have they had general anesthesia, have they not had general anesthesia, have they witnessed the procedure, the general anesthesia, where have they come back. So if that's like sort of some gentle range of motion, some stretching, getting people back into their bodies can be incredibly powerful. So there's no contraindications.
No. And I think, the psychological side of actually receiving loving, caring, focused touch after medicalized touch, so really the medical interventions are often very soulless. There's a different purpose there. So actually counteracting that with really bringing someone back into the body.
Well, informed touch, which is quite a powerful thing. So if you're asking this question, I think it's really about you wanting to help people who have gone through surgical procedures. So again, experience is the best teacher. Work with people, understand where they're coming from, open up your heart and say, like, I'd really like to work with you. I really need feedback as we're going along. You also want to look at what their skin is like. I mean, that tends to be one of the other things too. Like if people's skin is frail, should you be doing sort of compression work rather than oil work. So it's sometimes secondary questions rather than, you know, the surgery taking priority.
I mean, I think we really advocate not these kind of like blanket contraindications. So if someone has X, do Y, but actually look at the whole person. Good book to read, Tracy Walton, The Decision Tree Approach. So look at all the things that are going on for the client, and then you can look at, can I do massage at the site? What kind of massage can I do? There's loads of different ways to do massage. We're not just talking about Swedish massage here. So have a bit of an informed approach to thinking about it.
And don't be afraid to ask questions. So if you're asking the question around how soon I could work with somebody after surgery, it's because you're interested in working with that person. Also to think about all the other things that are happening and if they're under the care of other professionals, and not being afraid to ask questions. So if they're working with a physio or if they're working with a surgeon, Rachel's smiling at me quite nicely, what would they recommend as far as a treatment approach or different things that they're concerned about? And don't feel like you have to ask permission. You just have to declare that this is what you want to do in the person, because you have every right and they have every right to choose to have manual therapy, massage therapy.
It's the client's informed consent.
It's the client's informed consent.
Work with other health professionals.
Yeah, absolutely. But don't feel like you have to ask permission. Your main concern is the client. Yeah. So thanks so much. Ask the questions, get out there. Massage therapy in hospitals, hospice, all that's really happening. And you can get in the forefront of it and really make a difference in the quality of people's life after surgery. So involve yourself in the conversation on Twitter, on Facebook. Come see us at Jing. We do quite a few courses about scar work, working with people with cancer, fascial courses. So check out the website. All right, see you soon.
Thanks for watching.